we're doing very early studies in NRAS mutant metastatic melanoma. We're also doing early studies in BRAF wild type melanoma. When I say early, I'm talking about phase 1 studies where we're looking at different combinations of targeted drugs. So for example, NRAS mutant disease, we're looking at combination of a MEK inhibitor plus a CDK4 and 6 inhibitors. We're looking at combination of a MEK inhibitor combined with an MDM2 inhibitor in BRAF wild type disease. These are all phase 1 trials of targeted therapies. We're now also looking at triple therapy in BRAF mutant disease, so that's a combination of a BRAF inhibitor, a MEK inhibitor and a CDK4 and 6 inhibitor. We're also doing, as I said before, combinations of targeted therapies and immunotherapies, so a combination of a BRAF inhibitor, MEK inhibitor and an anti-PD-1, or a MEK inhibitor and anti-PD-1 in BRAF wild type disease. We're also looking at many different combinations of immunotherapies as well. So we've got it covered. We treat melanoma. We're trying to find the best combination of treatments to improve survival and make this a chronic disease and hopefully cure more people. I think the biggest questions and problems, or issues, I shouldn't say problems, facing physicians are, well, where will we go from here and how do we combine this plethora of drugs to actually maximise benefit for patients? We need to be smart about how we combine them and do our next set of studies. I don't think treating a patient in the clinic is an issue. I think it's exciting. There are many tools in our toolkit now. We're extending survival and it's about your experience and knowing what treatment to give when. It also depends on the funding bodies and how restrictive they're going to be about what order we have to give things. So as long as we're able to prescribe the drug we think the patient needs, I don't think that will be difficult. It will be whether funding bodies say you can only prescribe this first and you have to prescribe this second. That's very restrictive and is not good for patients.